Hi. So you and your doctor have decided to pursue surgery to help you breathe better through your nose. This is commonly done with a septoplasty and an inferior turbinate reduction, sometimes called a submucous resection. Now the goal of this surgery is pretty straightforward. We're trying to improve the nasal airway so that you can breathe more freely through your nose. Now before we talk about the surgery itself, it helps to understand the basic anatomy of the nose. If you look at a skull from the front, the nose is kind of like a triangle. I often think of that as the door to the hallway of the nose. Air needs to pass through that hallway, of course, on its way back to the throat and then down into the lungs. Now, inside that hallway, there are two main structures that commonly contribute to nasal blockage or congestion. The first is the nasal septum. The septum is the wall that divides the two sides of the nose right from left. In theory, that wall is straight, but in real life, about 50% of people have at least some bend, curve, or deviation of the septum. Now, if that deviation is significant enough, it can narrow one side or both sides of the nasal airway, of course, making it more hard to breathe. Now, the second structure that we talk about in the nose is the inferior turbinate. The inferior turbinates are structures on the outside walls of the nose. I often describe them as looking like hot dogs or long railings along the outside walls of the nose. They're covered with a tissue that swells and shrinks through the day in a natural cycle. Now that swelling and shrinking, as mentioned, is normal. The turbinates help warm, humidify, and filter the air before it gets into our lungs. Most people have that natural cycle where one side becomes a little more congested while the other side opens up, and then it switches back the other way. That cycle typically occurs about every 2 to 4 hours. So even now you might notice that one side of your nose is more open to air than the other, but give it some time and you may notice that it actually changes to the other side. Again, that's a normal cycle. The problem occurs when both turbinates are too large. If they're too swollen, both sides become congested at the same time and you can't breathe. Allergies can do that. A cold or sinus infection can do that. Dust and irritants can also do that. And even laying down at night can make it worse because gravity tends to increase congestion as more blood enters those turbinates. Now that's why some people say that they can breathe fine during the day, but when they lay down at night, their nose becomes more congested and they can't breathe while they're trying to sleep. Now, before we decide on surgery, we usually try conservative treatment with different medications. We're hoping that those medications will help shrink those turbinates, again, increasing the airflow through the nose. Again, we're doing this really targeting allergy is the underlying thought. We're using nasal saline rinses, nasal steroid sprays, antihistamine pills, antihistamine sprays, and avoiding irritants when possible. But if the airway is still blocked after trying these medications, then surgery may be the next step. So let's talk about the surgery. With the septoplasty, we are trying to straighten the septum and improve airflow. The goal is function, so we're trying to open the airway, and it's important to know that this really does not change the outside appearance of your nose. That is actually done with a different surgery called a rhinoplasty. With the turbinate reduction, we're trying to reduce the size of the turbinates themselves, but preserve their function. Of course, we don't want to remove them because they're there for a purpose, and the function is important, as mentioned, in humidifying, filtering the air. The problem is if they're too large and block the airway, then again, we're struggling to breathe. Now, there's different ways to make the turbinate smaller. The most common way is called a submucous resection. It's easiest to think about turbinate reduction like liposuction. So we make a small incision at the front of the turbinate, create a tunnel under the surface, and then use a small debrider to remove some of the tissues that are underneath. The surface lining is generally preserved, but the turbinate itself becomes smaller. Once healed, the turbinate still works, but it doesn't take up as much space. Now, this surgery is typically done in an operating room under a general anesthetic, which means that you're asleep for the procedure. Because you will be receiving anesthesia, you will need someone to bring you to and from surgery because you won't be able to drive afterwards. Now, after surgery, most patients wake up with a small amount of bleeding or drainage from the nose. Now, because of that, we typically place a gauze pad under the nose. This is sometimes called a drip pad, or even you'll hear a mustache dressing be referred to. Again, it's there to catch the bleeding that's normal after surgery. So again, a bloody nose is to be expected, especially during the first couple of days. You will also typically have splints inside your nose. I like to describe splints as little bookends. They help hold the septum straight while it starts healing. And they're also there actually to help keep the airway supported by pushing the turbinates out during that first week. You may be able to breathe through the splints or around them, but most people really feel pretty stuffy while they're in place. Again, that stuffy feeling or that congestion after surgery is normal. The first week is usually the most congested part of the recovery. You may feel pressure, stuffiness, drainage, you'll have some crusting, some bleeding, as I mentioned, and some people describe it as like having a bad head cold. Pain is usually pretty mild, but it does vary from person to person. It's typically managed with medications like ibuprofen and Tylenol, and some providers will give a few stronger pain medications as well if needed. Now, on the day of surgery, you and your family will be given specific instructions about pain control, activity limits, and which medications to avoid. One of the most important parts of the healing process is rinsing. Saline rinses may be recommended after surgery. Of course, follow your specific surgeon's instructions and preferences in this regard. I personally, however, like to tell my patients to rinse. Saline rinses, I feel, help clean out mucus, dried blood, and crusting. I've found it amazing how much better people tend to heal when they rinse consistently compared to those that don't. The rinses are not just for comfort, they're actually part of the recovery and healing process. Usually you will come back to the office about a week after surgery. At that visit, we remove the splints. There's a little suture that's snipped and then the splints come out. That's typically a great day because most people feel a big improvement once the splints are removed in their airway. All of a sudden their nose opens up and they're able to breathe. However, it is important to remember that you're still very early in the healing process. The inside of the nose is typically still pretty swollen, irritated, and crusty from some raw surfaces. So even after the splints come out, you still need to keep rinsing. Often we want patients rinsing regularly for another 4 to 6 weeks while the nose continues to heal. The final result is not always immediate. Breathing usually improves in stages. Now first, of course, as the splints come out and the airway opens up, then the swelling gradually improves, then the crusting and dryness tends to decrease. Over time, the nose continues to settle into its new baseline. Now, as with any surgery, there are risks. The common risks include bleeding, infection, continued congestion, the crusting, scarring, and the possibility that the symptoms may not improve as much as we had hoped. There's also a risk of what's called a septal perforation or hole in the septum. It's about a 1% chance, and these are difficult to repair, so we do our best to avoid them from the get-go. Now, sometimes patients will notice that the good side becomes their bad side. That can happen because the change in airflow pattern with moving the septum. But overall, your nasal airway and nasal breathing should be improved even if that's the case. It's also important to understand that, again, this surgery does not, what it does and doesn't do. Septoplasty and turbinate reduction are designed to improve your airflow. Again, as mentioned earlier, they are not cosmetic procedures, and so it won't change the outside appearance of your nose. They also don't cure allergies. So if allergies are part of the problem, you will likely still need allergy treatment after surgery, maybe sprays, rinses, and other medical management, as mentioned. The surgery improves the structure of the airway. It doesn't remove every other possible cause of congestion, though. So to summarize, the septum is the wall down the middle of the nose. The turbinates are normal structures on the outside of the walls of the nose that warm and humidify air. Bent septum or deviated septum with large turbinates can narrow that airway. If medical treatment has not really helped enough, then surgery may be recommended. Septoplasty straightens the septum, and turbinate reduction shrinks the inferior turbinates while still preserving their function. You should expect some bleeding, congestion, those splints after surgery, and saline rinsing, as mentioned. Again, the splints typically come out after a week, and then the nose continues to heal over the next several weeks to months. The goal is simple: to help you breathe better through your nose. Now you knows. Thanks for watching.